Welcome to the Eye of the Needle podcast, where we discuss healthcare innovation and explore how visionary entrepreneurs and change leaders are reshaping the future of our industry.
Hello, I'm Pam Arlato, and welcome to the Eye of the Needle podcast, where we dive into the hard truths and bold possibilities of healthcare change and innovation. Today, I want to speak directly to healthcare leaders who are just beginning their innovation journey. Maybe your CFO has asked, should we have an innovation program? Maybe we can generate some revenues through that or cut cost. Or your CEO has come back from a conference saying, do we need an innovation leader? Or your CMIO is discussing opening an innovation clinic. In our last episode, I talked with Lisa Mitchell, General Manager of Alloy Partners. We discussed how large enterprises often struggle with innovation. They get caught in a number of traps. First, they focus on efficiency. How many health systems do you know that are focused on FTE count to the detriment of growth or positive change? Or they are thinking about superficial innovation. Alloy refers to that as innovation theater. They pilot, they worry about what to call something, or even who should be the leader and what their title should be. Or they are so risk averse that they don't foster an environment with the required experimentation, deliberate inefficiency, and resilience. The reality is launching an innovation program isn't about adding a trendy new department. It's about changing your organization's posture from operations to innovation. And that's what we're going to unpack today. Let's be clear, innovation in healthcare is no longer a luxury. It's really a necessity. I want to remind you all of the journey to high-value healthcare. And we've talked about in earlier episodes 1.0, which is focused on building systems of records and are focused on the hospital as the kind of the center point. 2.0, we're building new capabilities, building analytics tools. We're optimizing that EHR that we implemented in 1.0. But when we begin to pivot to 3 and 4.0, we're really building a very new environment. 3.0 is about focusing on our patients and serving them in new and different ways, making their experience seamless, using new digital health and connected care tools. 4.0 is where we really start to innovate and build new business models and care delivery approaches. We look at health across the continuum, across the community, and try to prevent chronic conditions from happening in the first place, or at least slow them down. We're building smart health communities and really reinventing the way we work. So the reality is that many health systems today are stuck at 2.0 or are beginning to dabble in 3.0. They're still focused on being as efficient and standardizing and thinking about compliance quite frequently. And these crowd out the necessary cultures, capabilities for 3 and 4.0, which are experimentation, creativity, and speed. So before you launch an innovation program, I would ask you, are you ready to think differently? Innovation is the process of identifying unmet needs or challenges and developing new or improved ways to solve them. And that could be through changes in care delivery, technology, business and operating models, or even partnerships with outside players, or some combination of the above. What is important that you've seen one innovation program, and it's very important to go through a process of evaluating what it's going to mean to your leadership, to your board, and to your organization. One question I hear quite frequently is why now? Why is it so important today? Well, as you look down this list, all of these are challenges facing our industry. A lot of our traditional approaches, we've done all we can do. We've kind of hit the ceiling in terms of their impact. We are seeing our consumers and our employers expect very different things. Other industries are ahead of us, and they have already begun their digital journeys. And consumers see that. We are getting competition from outside players. Regulations are shifting. We're going to see the accelerator put on for value-based care in the future. Our technology is maturing. In the past, we were implementing big enterprise systems like EHRs, CRMs, and ERPs. But today, there are a lot of different combinations of systems that can help us reinvent our care processes and our business processes. We, of course, since COVID, have faced burnout from our workforce, and it makes it essential that we make the experience of working with our organizations more effective and have more satisfaction. To innovate in healthcare, we must first reimagine our organizations as digital platforms where clinical excellence and data intelligence go hand in hand. So rather than just having an analytics program, we will see a lot more data tools embedded in new digital offerings. I do think it's important to redefine our organizations and think about them a little bit differently than we have in the past. In the past, we defined the hospitals based on the beds, the health systems based on the facilities, but we're really pivoting to a point that our healthcare enterprise will be a data enterprise. It will be defined by data, algorithms, and other platforms. Every interaction we have today, since we've deployed EHRs and other systems of record, will create a digital footprint. And if we harness and are able to follow that patient wherever they may go, we can talk a lot more about whole person care, personalized medicine, so that we truly can, as I mentioned earlier, prevent these chronic conditions from happening in the first place. But innovation requires a digital scaffolding. And when I say digital, that could be a workflow product. It could be an AI-driven product. We're seeing the entry of chatbots and remote patient monitoring, ambient tools where we are able to replace the work of people and use voice in ways that we haven't before. And all of that's going to rely on clean, connected, and data that we understand and can apply in a contextual manner to our specific organizations. We're also going to be looking more, instead of static, backwards looking historical data, to more real-time information that will allow us to pilot and then quickly scale these new ways of working. Data is going to transform the way we operate. It's going to be viewed as a strategic asset, not a tool. It's going to actually create an innovation engine for many of our organizations. And winning health systems are really focusing on building that unified data set, not having a lot of disconnected systems and tools. The future of healthcare will be digital first and data driven. We're going to have a whole number of digitally orchestrated work processes, patient journeys, and ways of augmenting our workforce. Bricks and mortar can no longer compete with digitally enabled and distributed care models. So that's really kind of the perspective that organizations need to have if they haven't started their innovation journey and as they think about it. So let's look at the history of innovation. It's not new to healthcare. there have been innovation organizations and programs for a number of years. Geisinger, Kaiser, Intermountain, and a number of other health systems have been doing this for a while. In 2012, we had about 25 innovation centers that were part of health systems across the country. In 2022, we had about 110 innovation centers that were part of health systems nationally. We estimate now we have right around 200, and by 2030, we're expected to have about 340 across the industry. But the news is mixed. 88% of innovation pilots fail to scale today. So that means the industry does a pilot or an organization does a pilot, and they don't intentionally have a plan in place to scale it. While 200 health systems have launched innovation centers, only a small percentage have integrated the work of the innovation center with their operating DNA or their care delivery organization. And almost 90% of health system executives name innovation and digital transformation as a top priority, but 3 out of 4 say they're not delivering on it. The gap between ambition and execution is real. So let's discuss the characteristics of organizations without a clear plan for innovation. They say no more than they say yes. They still have siloed operations focused on function or specialty. They still have that risk-averse culture. They've made minimum investment in resources or dollars to support these efforts. They don't have a governance process or executive sponsorship for innovation. They really don't have methodologies or processes or tools so that they can have a repeatable way of working in the innovation area. And they're really not connected to others who are innovating. So let's look at the different models that organizations use when they have an innovation center. And I've got on the right some example organizations that use these models today. One is an internal consultancy. That's where you're working on problems you've identified. You bring in subject matter experts to do redesign, to envision new workflows, not just map your old ones to your technology or optimize your technology. And they are really focused on the core business. How do we improve our way of operating? Another that people often do with partnerships is they create an innovation studio. They design based on using techniques for digital solutions and human-centered design. They really try to reinvent the patient experience. We hear a lot about the digital front door, and a number of those efforts are happening in innovation studios. Another is they are creating new intellectual property. So they actually focus on taking something they've created at their organization, usually a product company. Sometimes it's a medical device, and they legally go and license it, put together the appropriate partnerships, and they make sure that their investment returns funds to the organization. Another is a corporate venture arm, which is fairly similar. And they basically may not actually develop the product at their organization, but they are taking investments and almost like a venture capitalist putting money into certain companies that they believe will scale. Accelerators and incubators help launch startups. They do early stage collaboration, and they validate the technology. And then finally, some organizations, particularly our academic medical centers, are focusing on, let's get a grant, let's partner with another organization, and they'll launch the new initiative with minimal internal investment using that grant funding. And you can see the organizations who've approached these various models, as I mentioned on the right. I want to give an example of one that is a hybrid of several of those models. And in fact, you'll see this in many of the more mature innovation arms. Freighter Health in Milwaukee and the Medical College of Wisconsin founded Inception Health in 2016. It's really a combination of an innovation studio. They actually do the product design and engineering, and then they have a venture arm that they have developed, and then they have partnerships with other organizations to help launch these companies. So they function both as that internal delivery studio, but they're building bespoke digital tools and virtual care solutions. They have the investment, as I mentioned earlier, and partner with external tech vendors and have this strategic startup and co-develop these innovations. And then finally, they embrace a digital-first architecture, treating technology as a strategic asset, not just a support infrastructure. We worked with them several years ago, and it was very interesting to see the number of companies and partnerships that they had across the country. I also want to share with you, going back to those original models, we want to look at the various models for organizations new to the innovation game, and we want to help you think through where will you most likely have success. So ranked number one is an internal consultancy. So the ease of launching this and the likelihood of success is very high. Next on the list is a studio, an innovation studio. Often you might work with a local incubator or a company like Alloy that we mentioned in that last episode to launch it. So the ease of launching is medium to high, and the likelihood of success, once again, medium to high. Third is a grant partnership. The biggest challenge with grants is that sometimes the grant provider or the issuer of the grant will have very specific outcomes they want you to meet that may or may not support that entrepreneurial effort that you're trying to roll out. But the likelihood of success is still medium. More difficult are accelerators or incubators, and we don't usually find health systems starting here alone. They still can have medium success, and ease of launch is medium. The most difficult are creating that corporate venture arm and commercialization office or IP office. Both of those are lower in terms of ease of launch and likelihood of success. But thinking about how to begin the journey, how do you put your toe in the water? Sometimes it's good to start before you really jump full scale into it. Start with one clear problem that you want to solve. Build a cross-functional team, learn some of the tools and techniques, and then some of those tools as listed here are design thinking, lean startup, business model canvas, agile, jobs to be done. All of these are great methodologies for a team to learn and begin to see how this is a little bit different from what they may have done in the past. In fact, I often find one of the biggest mistakes people make is they come into this like they're managing an IT project, and an IT project has a very clear beginning and end, and they're really often more about optimization, making current systems and processes faster, cheaper, or more compliant. An innovation project would use some of these tools to think about transformation. How do we build new experiences, new models, or even businesses that don't exist today? So if you're trying to do like a scheduling algorithm for your EMR, that would be project management. That's your optimization. A new virtual care marketplace for existing and new patients, that would be innovation. The real critical thing is, as opposed to worrying about an ROI or thinking too early about the results, It's focusing on the mindset, learning to move from that operating to innovating mode. And the real focus is testing early, failing fast, and learn continuously. Some of the pitfalls I mentioned already, but a few others I want to cover. I mentioned trying to measure the ROI too early, no clear governance, trying to do too much too fast, thinking just because you've had a pilot that you're innovating and confusing that with progress. And I also mentioned the traditional IT project or strategic initiative. So I would emphasize to new innovators that really differentiating between the old way and the new way will help you develop a clear-cut approach, philosophy, and strategy for innovation. The biggest risk today is doing nothing at all, and health systems that fail to innovate now may not even be here in 10 years. I do find it very important that after you've tried an innovation initiative or two, that you really recognize that you are developing new leadership muscles. You've got to be comfortable with ambiguity, willingness to test and learn, and look at the incentives that reward experimentation in your organization. As you gain traction, it's important to begin to formalize your strategy, convert your very high-level ambiguous goals into specific, clear resource plans with accountable owners. Invest in core capabilities that might be, some budget for some modernization and reduction of your IT debt, analytics tools, innovation, staffing, and talent. Build a governance process specifically for this. So create an oversight group to select, fund, and shepherd the projects or the initiatives. And make sure that you recruit, train the right people who can lead these efforts. I've also found that it's helpful to get an advisor or a partner who's been down this road before, so they can help you not make the same mistakes that have been made time and time again in other innovation initiatives. My final advice on this is start small and scale. Begin with targeted initiatives, intentional pilots that you intend to scale, measure impact, and replicate success. Here are my final thoughts. Launching an innovation program means shifting from incrementalism to intentional disruption. It's not easy, but it's necessary. And remember, you don't have to do it alone. As I mentioned earlier, there's a whole community of thinkers, builders, advisors who've been there before. So ask yourself, not just what can we innovate, but what's keeping us from a full commitment. Thanks for listening. If this episode sparked ideas or questions, connect with me on LinkedIn or drop a comment in the podcast page. Let's keep moving healthcare forward, one bold step at a time.